Hello everyone, I'm Dr. Bang, the hair wizard who protects your hair. It's a true pleasure to meet you all. This is indeed a complex and challenging topic. I'm aware that many of you might be quite interested in this subject, but hair transplant revision surgery might be performed because of dissatisfaction or perhaps because initial expectations were set too high. Sadly, it could also be due to complications or issues with the very first surgery. Two things are always crucial in a hair transplant: the design and the density. Both are critically important. You need a design that truly complements your face, one that aligns with your expectations and personal desires. Then the density must be packed as robustly as possible to ensure proper and abundant growth. In short, the design can be ruined, the density might be compromised, or even both could end up being botched after a hair transplant. But at the clinic, they might say this level should satisfy you. Some clinics will say this density is the best we could do, and honestly, I sometimes say that too. Well, what I mean is, because we are transplanting the patient's own hair onto the patient's scalp, there are inherent limitations that exist. Naturally, I'd like to plant 10 hairs and see all 10 of them grow successfully, but sometimes there are negative factors that prevent this. For instance, blood circulation could be diminished, the condition of the harvested hair might not be satisfactory, or perhaps you're unaware of ongoing hair loss, leading to ineffective medication treatment or other medical interventions. If you're unhappy with your hair transplant revision surgery, it's best to first go back and consult with the clinic where you had the procedure. If you determine that you need to undergo surgery, you should consider if the design is the issue, or if there's insufficient density, or if both are satisfactory but your expectations are simply too elevated. And if necessary, you should pursue further consultation. Because it's about achieving a particular image, a hair transplant revision surgery can certainly be performed. No matter if the primary surgery was incisional or non-incisional, this is called the donor area. The back of the head hair. If the back of the head hair isn't too damaged, there's really no major limit to the number of surgeries or the amount of hair. People ask, how many times can I have it redone? Usually you can safely do it 2 or 3 times. It's typically possible to achieve perfection twice. However, by the 3rd time, I generally advise that the procedure mainly serves to fill in any sparse areas. In the worst case scenario, if you have low density in the back and a large scar, then frankly, you'll have to lower your expectations, because the available hair volume won't be that much. So when it comes to revision surgery, there's no right answer. If a patient desires it, and it genuinely benefits them and contributes to their happiness, then it's certainly a viable option. Then I think it would be a good idea for you to go ahead and try it out. I think taking a plunge and getting a revision surgery isn't a bad idea. Today, I briefly touched on the topic of hair transplant revision surgery. If we delve deeper, there's just so much more to discuss, as it greatly varies, with each situation being truly unique. Therefore, I will dedicate more time in the future to elaborate on this topic. Thank you for listening.